All right, we'll go ahead and get started. So welcome to our webinar, Understanding the Public Health Impact of Dementia. Thank you so much for joining us today. My name is Eva Jackson, and I am an Associate Director with the Healthy Brain Initiative at the Alzheimer's Association. We are so excited to share the launch of this new public health curriculum module with you today. Much of the work that we do on our team is for public health departments, but this curriculum is designed for public health students, educators, and professionals. And we are thrilled to have so many of you from each of these diverse backgrounds here today, so welcome. Before we get started, there are a few housekeeping items I'd like to mention. So first, we are recording today's presentation so that we can share it with those who are unable to attend today. Second, if you'd like to use closed captioning, you can enable it using the toolbar at the bottom of your screen. And since we will be recording and you do have that closed captioning available, AI recording tools will not be allowed in the webinar today. And third, if you have any questions during today's presentation, please put them in the Q&A box, and our speakers or someone from our team will respond. And we will also hopefully have time at the end to respond to questions as well. So let's get started. So today we will be talking about our new public health curriculum module, Understanding the Public Health Impact of Dementia. So I will share some background on the Healthy Brain Initiative and the development of our broader public health curriculum. And we will then be joined by three amazing speakers who will share their unique perspective and work around dementia as a public health priority. So first, we're going to hear from Alicia Etheridge, who is the lead for the Alzheimer's disease program team at the Centers for Disease Control and Prevention. Second, we will hear from Brittany Baines, who works in the Office of Dementia Services BOLD program at the Kentucky Cabinet for Health and Family Services. And third, we will hear from Dr. Lillian Madrigal, who is an assistant research professor at the Rollins School of Public Health at Emory University. We will then do a demo of the new Understanding the Public Health Impact of Dementia module to share how you can use this curriculum in your setting. I'd also like to acknowledge the cooperative agreements with CDC that help develop the work of this module and allow our speakers to be here today. Please note that the thoughts and opinions expressed today are solely those of the speakers themselves. And as mentioned earlier, we will be recording the webinar and it will be shared with all the registrants. So any personal recording of the webinar or use of AI assistance to record is not allowed. So first, a little bit of background on the Healthy Brain Initiative, or the HBI as we call it. The HBI is part of our public health team here at the Alzheimer's Association, and we work to support infrastructure for brain health, as we believe that everyone deserves a life with the healthiest brain possible. One of the ways we support this public health infrastructure is through the publication of the HBI Roadmap. And the HBI Roadmap is a public health strategy focused on reducing the risk and impact of dementia for the greatest number of people possible. The updated roadmap was released a little over a year ago, and if you're interested in learning more about it, reading it, or using any of the supporting resources, you can find them on our website at alz.org/HBI Roadmap. And if you are somebody who is using the HBI Roadmap, this public health curriculum directly supports the outcome in the workforce domain to increase knowledge and skills of the current and future workforce. So our intent is that this curriculum is something that can be used by you to support the work that you are doing with the roadmap. So the development of this public health curriculum came from work done on previous roadmaps and in partnership with the Rollins School of Public Health at Emory University. In 2015, the curriculum was developed under the guidance of an advisory board. And then in 2016, the curriculum was piloted with faculty from 15 undergraduate public health programs. And then it was released in the fall of 2016 as a 4-module program. Initially, the curriculum really was just intended for use in these undergraduate public health courses. But once it was out there, there was interest and uptake by advanced degree programs, as well as interest from the current public health workforce. So from 2018 to 2020, the curriculum was updated and a video component was added, giving instructors the option to have students view the module content online, as well as have activities that they could complete in a classroom setting. About a year ago, we celebrated the launch of a brand new online interactive module on health equity and dementia, followed by the launch of a module on public health and dementia caregiving a few months later. And so today, I will be showing you the brand new Part 1, Understanding the Public Health Impact of Dementia module. This is the first of 2 modules that are the update to those 4 original curriculum modules. Part 2 will be coming later this winter. So together, they will replace those original 4 PowerPoint and recorded videos that lived on our website and YouTube. And we're excited to share this updated information with you in the new interactive format. But at this time, I'd like to go ahead and turn it over to our speakers to share how they have used or plan to use the modules in their work. So first we have Alicia Etheridge, who will be sharing why training public health professionals on dementia is a public health priority and how her team at CDC supports use of this module. Alicia is the lead of the Alzheimer's disease program team on the Healthy Aging branch in the Division of Population Health in the National Centers for Chronic Disease Prevention and Health Promotion at the Centers for Disease Control and Prevention. Welcome, Alicia.
Thank you, Eva. And thank you to the Alzheimer's Association for inviting me to discuss this pressing issue that demands our immediate attention, the training of current and future public health professionals on Alzheimer's disease and related dementias. Next slide, please. And next slide. So Alzheimer's disease is not just a medical issue, it's a significant public health issue. Nearly 7 million Americans are currently living with Alzheimer's, and this number is expected to almost double by 2050. The economic impact is equally staggering, with the cost of care expected to reach nearly $1 trillion by mid-century. These figures aren't just statistics, they represent real people, our parents, grandparents, friends, neighbors. The burden of Alzheimer's extends beyond those who are diagnosed. It affects families, communities, and the healthcare system at large. Next slide, please. Understanding the gravity of Alzheimer's disease and related dementias requires us to see it through the lens of public health. Over 95% of those living with Alzheimer's also have at least one other chronic condition, such as heart disease, diabetes, or stroke. This intersection of multiple chronic conditions complicates care and demands a comprehensive public health-oriented approach to treatment and support. Moreover, more than 11 million caregivers provided 18 billion hours of unpaid care in 2023 alone, valued at over $346 billion. The emotional, physical, and financial toll on these caregivers is immense, further emphasizing the need for systemic public health interventions. Next slide, please. A strong public health response includes implementing population-based solutions that include promoting brain health, increasing access to early detection and diagnosis, and providing support for those living with dementia and their caregivers. The tools and strategies that we implement today will shape the health outcomes of millions tomorrow. And we have the public health tools and strategies that can improve health outcomes for people affected by dementia in every community. Next slide, please. The CDC has recognized the importance of this issue and has been at the forefront of guiding public health action through initiatives like the Healthy Brain Initiative Roadmap series, which Eva briefly mentioned. Next slide. The most recent roadmap for state and local public health consists of 24 actions that public health can take to address Alzheimer's disease and related dementias across the life course. Each of the actions are consistent with 4 of the essential services for public health and provide a framework for public health professionals to ensure a competent workforce, monitor and evaluate progress, develop policies, mobilize partnerships, and educate and empower communities. Next slide, please. Additionally, the CDC has established 3 building our largest dementia or BOLD public health centers of excellence, with each center focused on one topic-specific area across the disease continuum. There is a center focused on dementia risk reduction, early detection of dementia, and dementia caregiving. Each center works to identify, translate, and disseminate promising research findings and evidence-informed best practices that address social determinants of health and use a nationwide systematic public health uptake by state, tribal, local, and territorial public health agencies. Next slide, please. CDC also funds 43 state and local public health programs, along with the Northwest Portland Area Indian Health Board through a cooperative agreement. So 13 of those grant recipients are working to build their public health dementia infrastructure, while 30 recipients are working to implement developed strategic plans to address Alzheimer's disease in their jurisdictions in collaboration with their multi-sector coalitions. They're also developing community clinical linkages among healthcare systems and existing services, public health agencies, and community-based organizations. They're also educating the general public, healthcare providers, and other professionals about Alzheimer's disease and related dementia topics. Next slide, please. CDC also hosts the Healthy Brain Resource Center, which is an online, searchable, and centralized repository of resources related to brain health, Alzheimer's disease, and dementia. It provides access to credible resources from federal, state, local, and tribal agencies, national nonprofit organizations, academic research institutions, and the private sector, all in one location. The resources included within the center help public health agencies to plan and implement effective Healthy Brain Initiative Roadmap Series actions. The Resource Center currently houses more than 400 resources, and all of these are vetted by an external committee of experts. Next slide, please. One of the most significant steps that we can take is to ensure that our current and future public health workforce is well trained in understanding and addressing Alzheimer's and related dementias from a public health approach. The public health curriculum developed by the Alzheimer's Association, CDC, and Emory University for professionals is an invaluable resource that provides the knowledge and skills necessary to tackle this issue. Training programs aren't just for those directly involved in dementia care, but they are essential for public health professionals given the widespread impact of the disease. In conclusion, the importance of training public health professionals on Alzheimer's disease and related dementias cannot be overstated. And this is a prime example of public health in action. CDC has been a supporter of this work since it first began in 2016, and we're really excited to see the continued evolution and impact of the curriculum, which equips public health to respond effectively to one of the most significant public health challenges of our time. So by integrating this knowledge into public health work, we can improve health outcomes, support caregivers, and ultimately reduce the burden of Alzheimer's in our communities. So let's commit today to making Alzheimer's and related dementias a priority in our public health training and practice. Together, we can use these tools to act now and make a lasting impact on the lives of millions of Americans. And now back over to you, Eva.
Thank you so much, Felicia. Wonderful to have you here sharing some of the work that you do and some of the work that CDC does, and just that celebrating that partnership that we've had on this program together. So next, I'd like to welcome Brittany Baines. Brittany will be talking about the work she leads in the Office of Dementia Services, the BOLD program, to support professionals learning about dementia and its connection with this module. Welcome, Brittany. Oh, and I don't think we can hear you. Can you go off mute?
Yeah.
Thank
Sorry.
you.
There we go. Thank you, Eva, and thank you all for having me here today. And good afternoon from the great state of Kentucky. Next slide, please. Dementia in Kentucky. So let me give you a little bit of background about the work that we're doing here in Kentucky. Uh, Dementia prevalence in Kentucky has been, since 2020, there's been approximately 75,000 people living with dementia across the state. And by 2025, we'll see an increase of almost 15%, indicating that we'll have a high growth over the next 5 years. As far as Kentucky caregivers, we have over 157,000 Kentuckians who identify as a caregiver of someone living with dementia. That equals to about 302 million hours of unpaid care, and also $4.8 million value of caregiving services. 65% of the caregivers in their own health reported that they have at least one chronic health condition. 39% of caregivers reported suffering from depression, and 21% of those Kentuckian caregivers reported having poor health. Over the next few years, the projected healthcare needs in our state indicate that we'll have a 35% growth of need for services. In 2020, we had 22,000 care identified aides, and as of 2023, we'll need 30,000. Next slide, please. So what were we going to do about this across the state of Kentucky? So in 2023, Kentucky was awarded the BOLD grant, Building Our Largest Dementia Infrastructure grant, funded by the CDC. And with this grant, we have a collaboration between the Department for Aging and Independent Living, the Office of Dementia Services, the Department for Public Health, and the Division of Prevention and Quality Improvement. The Building Our Largest Dementia Infrastructure grant, funded by the Center for Disease Control and Prevention, is designed to enhance the public health infrastructure across our state. This 5-year grant aims to implement evidence-based strategies to reduce dementia, risk reduction, and improve care and support those living with the disease. In the first 2 years of this grant, we'll be focusing on building our coalition. Our BOLD coalition will provide and have members who are providers, leaders, champions of both public health and aging fields. During this period, the coalition will create goals and objectives targeting dementia risk reduction, brain health across the lifespan, and health equity. The goals and objectives will be outlined in the 2025 Dementia State Plan. We'll work to build the groundwork focusing on risk reduction, early detection, and brain health. And then the partnerships that we'll create will be with different organizations across our state. So that will be such as Norton's Healthcare, Alzheimer's Association, the AmeriCorps Senior Care, Louisville Office of Resiliency, the U of L Traeger Institute, and UK Sanders Brown Center on Aging, to name a few. With the first year of this BOLD coalition grant, or with the BOLD grant, we'll work to develop a curriculum or identify a curriculum that will educate the leaders within our coalition. To accomplish this goal, we selected the health equity in dementia using a public health lens to advance health equity in Alzheimer's and other dementias curriculum created by the Alzheimer's Association. We decided on this curriculum because this course allowed for our statewide coalition to have the ability to complete the training on their own time, at their own pace, and provide certificates upon completion. From there, the curriculum is going to be used to educate the wider public. Next slide, please. Some of the milestones and achievements that we've achieved across our state leading up to the BOLD grant, and I won't highlight all of these, but I'll just highlight a few. The workforce development, working to partner with different agencies across our state, and also getting a curriculum and review and approval. Getting our Building the Gap collaboration with 4 areas on aging. We have created a quarterly dementia education webinar series, and then also working around workforce development, dementia training required for all area on agency staff. So that's some of the milestones that we have in the state of Kentucky. And also fast forward into 2024, the Office of Dementia Services was able to hire more staff, and then also once again establishing and getting the BOLD grant. So next slide, please. Next slide. I'm sorry. Next slide. So what are we going to do with this work to move Kentucky forward? So continue to move Kentucky forward, marrying a public health and aging approach. We'll continue to have dementia training. So currently the Kentucky BOLD program has used the Alzheimer's Association public health curriculum to educate the BOLD steering committee, the coalition members, and over the next 2 years of the grant cycle, we have planned to use the upcoming Alzheimer's Association curriculum to further educate our coalition and also its steering committee members. Also to help ensure that we can train the current and public workforce of healthcare workers, public health workers, and aging workers, and then also train our aging workforce to continue to move the work forward and the needle forward across the state, across public health and aging. As a current BOLD recipient, we plan to continue to ensure a more competent workforce surrounding ADRD topics by using the Alzheimer's Association public health curriculum as our training for the Kentucky BOLD Coalition, for dementia awareness, and for workshops that we plan to have in the future. In future use, we plan to use the curriculum to expand these efforts to train the current and future workforce. And as these trainings provide interactive and real life applications that applies directly to the work that's being done across Kentucky. Next slide. Thank you. And I'll turn it back over to you, Eva.
Thank you so much, Brittany. And we just really appreciate hearing about the work that you're doing and the way the curriculum can fit into that work, especially as it's, getting off the ground. It's exciting to hear about that.
Thank you.
Yeah. And so now I'd like to go ahead and welcome Dr. Lillian Madrigal, who's an assistant research professor at the Rollins School of Public Health at Emory University. So today she will be talking about training the next generation of public health professionals in dementia through her classes and her work. Welcome.
Thank you. Hi, everyone. Like Ava said, my name is Lillian Madrigal. I'm on faculty at the Rollins School of Public Health in the Department of Behavioral, Social, and Health Education Sciences. Thank you, Alzheimer's Association, for having me today, and happy new school year to all of those faculty and instructors that are joining us here today. So Emory Centers, which is part of the Rollins School of Public Health, we have been involved in the development of this curriculum from the start. And as a faculty member, I use this curriculum in my classes. And one of the reasons at Rollins we're so excited about this curriculum is because it's in line with our latest strategic plan, which includes 6 goal areas. And one of them is focused on transforming our offerings, where our goal is, as you can see here, to broaden who we teach, diversify how we teach, and enrich what we teach in response to the evolving public health priorities and emerging challenges. And this curriculum is a good way, a creative way to bring valuable information about a significant public health issue to our students, and do it in a way that allows faculty and students the opportunity to use the modules for both synchronous or asynchronous learning and to get deeper into this topic. So on the next slide, you'll see some points that have already been highlighted by my colleagues, but this is a topic of high importance and relevance, right? Dementia is a growing public health issue that our future public health professionals need to know about and understand the impact on individuals and communities. And so this curriculum is a nice ready resource for faculty covering this topic at whatever level fits with their existing resources or coursework. And I think there's a lot we can do to inform our students more about dementia. We focus on a lot of diseases, both infectious and chronic. However, dementia is a big one that doesn't get a lot of attention. And so I think this is really important for our future public health force to have this knowledge about dementia and what public health can do. So this is a great way to introduce students to that information through that lens of public health. It also introduces them to organizations like Alzheimer's Association and their role in public health. That's another one of our strategic goals at Rollins, is to engage in these multi-sector partnerships with people at the State Health Department, at CDC, at Alzheimer's Association. So it's a nice way to highlight these collaborations. And we've also done a lot of surveys with our students, and especially since COVID, we've gotten a lot of feedback that they want more online asynchronous learning opportunities that they can engage with on demand. So these courses also fit that kind of modality of learning that our students are really hoping to get more of. So for the past 2 years, I've assigned this health equity module, the health equity module, to the students in a seminar that I teach around public health and implementation practice. So this has been a useful tool in our class, not only for the content, but also to increase content around diversity, equity, and inclusion. So each semester, faculty here at the School of Public Health are asked to complete a DEI form. It's a way to review their syllabi and to think about ways where they can increase DEI content in a meaningful way. So that the health equity module, if you haven't used that yet, it is a really wonderful way to do that. And then the other thing is it's a nice example of how we can train the public health workforce. So letting our students know that there are resources for them to use even after they graduate from Emory, and that can get an additional training so they can come back to the Alzheimer's Association site and see what additional modules are there for them to continue to build their skills and knowledge around this area. And I think I have an animation. Yes, most importantly, the students like it. So feedback from our students have been that they are super impressed with the format and the quality of the module. And so it's nice to know that they like this material as well. So then, lastly, I just want to touch on this new module here around public health and dementia. I like that I can use this as kind of the first in a series because it gives that nice overview of what dementia is and why it's a public health issue. I suspect it will be new information to most of the students. And then you can use the other modules as a nice complement. And you can also assign this prior to class and then follow up with an in-class discussion. I think a couple nice things that accompany this module is there's a content document. So you can download that as a PDF and review what the module content is that the students will be learning about. And then there's an instructor guide, and that has a wealth of resource like discussion questions, some sample test questions, links to the videos in the module if you want to show any of those again in your class. So I plan on using these, giving this to my students ahead of time, having them go through the module, and then using some of those discussion questions and videos in my class to have some good discussion about it. So for faculty members or course instructors, I highly recommend taking a look at this module and the others and seeing how they fit into your courses. And I think that's it for me.
Thank you so much. It's really helpful to hear about how you're using this course and how you think it will be useful in your course content. So thank you. And I just want to thank all of our speakers again today. One of the things that's most exciting to me about this module and the rest of the curriculum is how it can be used by so many different people in so many different environments. So we really appreciate hearing your diverse experiences and your expertise with us. So I am now going to show you pieces of our new module and then walk you through how you can access and share the module on understanding the public health impact of dementia. I will also highlight some of the resources that we just heard about that supplement the online learning module and how they can be used. So you log in and this is the landing page when you open up the interactive module. I will note up front this module will save the learner's progress so they can return to it whenever they like. Today, I will just share a taste of some of the interactive components offered by the module and then encourage you to go check it out for yourself. So in the module, learners read through many different topics, they complete activities, and they navigate different sections. So we start the module with an interactive activity to help learners understand the scope of dementia. So this helps to engage the learner meaningfully in the public health statistics from the very beginning, grabbing their attention before we dive more deeply. We include activities throughout the module to ensure the learner is participating in and applying the learned content throughout. We also include reflection points and videos throughout to center the lived experiences of people living with dementia and caregivers. This helps to maintain that focus that while this is a public health issue, the impacts it has on daily lives and experiences is important and important to center. So we want learners to remember these individuals while also grasping the magnitude of the public health impact through data and statistics. And as this module is replacing our original introductory learning materials, we are providing a baseline understanding of dementia for public health students and professionals who may be new to the topic. So the first section is on what is Alzheimer's and dementia. And this answers one of the most common questions people have, which is what is the difference between Alzheimer's and dementia? And then it dives deeper into what dementia is and different types of dementia. The next section looks at the intersection of dementia and public health, exploring the prevalence and costs, the impacts, and public health solutions. One of the activities throughout this module are what we call let's practice moments. In these activities, the learner watches a scenario they may encounter as a public health professional, and then is asked to respond to a question or questions. Some of the questions do have right or wrong answers, but they don't impact the learner's progress, while others are asking for the learner to think about which of the possible correct answers they would want to use. These interactions are designed to help a learner pause, think about, and apply the information they've learned. The module then covers the timeline of public health engagement through an interactive brain puzzle activity. So this is designed to help a learner understand the history and the growth of public health investment and action on dementia and brain health. The module then covers the Dementia Life course and dives into the public health action that can be taken on dementia at the primary, secondary, and tertiary levels. So for example, in the primary prevention level, the module explores the 10 healthy habits for your brain as interactive flip cards with the action on one side and then more information about it on the back. And the module ends with a video summarizing the key concepts covered in the module and offering guidance on using the HBI roadmap for change. So here I will go ahead and make a plug for our next module, which is Public Health and Dementia Part 2, Implementing Public Health Strategies for Dementia. And this module will be coming out in the next couple months, and it will take learners on a deeper dive into the HBI roadmap, featuring public health departments who have applied the roadmap and encouraging learners to really think about what their next steps might be to use the public health guidebook for their work. So stay tuned for our e-news for the release announcement of when this comes out. And so finally, our module concludes with additional resources and readings. And these are things a learner could look into to continue to engage with or apply what was learned in the module. All right, well, that's the overall look and feel of the module, which I hope is just enough of a taste to make you want to go dive into it fully. So to access it, you can go to our website at alz.org/public health curriculum. And if you actually want to go to the website now, feel free, you can walk through this process with me. I'm going to go through some of the resources that will be available on our website, as well as how to log into the module. So as I mentioned, we have several resources that supplement the module itself. The first resource I'll mention is a one-page flyer that it covers the entire curriculum. It's a short, succinct way to share information about the curriculum package with other partners, organizations, instructors, or learners who might be interested. The next resource I'll mention is a one-page flyer that explains how to access and complete the curriculum. So this is designed so that a professor or a health department leader can just share this document to guide learners through the process of accessing and using the materials. The third resource I'll mention is the instructor guide. As Lillian mentioned, it's designed as a supplementary resource for instructors to use to complement the material learned in the interactive module. So this instructor guide has discussion questions, has some application-based learning activities, has sample test questions, video resources, graphic resources, and then additional readings and resources. Hopefully this is something that you can use in your classrooms or learning environment. And then finally, we have the link to the module itself. So here you would just click on Start the Module, and it takes you to our learning management system. So this is the Alzheimer's Association's learning management system, and you can get here using the link at the top of the page. I just personally find it easier to go through the link on our website because that has all the other resources as well. But at the top, you will see our public health tab, and this is where our modules on health equity, on dementia caregiving, and this new module live. So in order to access this and other free education from the Alzheimer's Association, you do have to log in with a free account. Therefore, when I get to this page, I always recommend logging in first, as it makes finding all of the other courses that I've started or have completed much easier. So if you click on Login and Register, it'll bring you to a login page. And if you have used the Alzheimer's Association's learning management system before for other trainings, you can enter your existing username and password on the left, and then just click Login. If this is the first time you've used the system, you can click on Create Account on the right. And again, once you have an account, it's really easy to access and keep track of all the many resources available on the learning management system. So after you've either logged in or created an account, it takes you back to the page that you were just at, and now you can click, it will either say Add to Cart or View Enrollment here. So after you click on Add to Cart or View Enrollment, it takes you to this page where you can launch the interactive module. And when you click Launch, it takes you to the landing page of the module that I showed you earlier, and it will take about 60 minutes to go through the module, and we don't have time for that now, but I do hope that you're able to take some time to go through it and see how you can use it in your setting. And then after a learner has completed the entire module, there's a short survey that's unlocked. And this survey is a user experience survey, but it does ask about what was learned and how it will be applied moving forward. And as many of you know, being grant funded, we really appreciate the response and feedback we receive through the completion of this survey. And then once that survey is completed, then the completion certificate is unlocked. So you can click here to print your completion certificate. And it provides you with a downloadable PDF of a completion certificate with the learner's name and the completion date. So this is something that learners can print or share with their instructors to demonstrate completion of the module, since it is only available once the entire module and survey are completed. So as mentioned earlier, to help in your teaching environments, we developed the step-by-step instructions guide for learners to follow. So this is something that you can just post or share that guides learners through all those steps I just shared with you and be able to access the module. And again, our goal is that this is something that you can take and begin using as soon as you want to. It's something learners can do individually, but it does come equipped with those additional learning supports for classroom settings to supplement that online learning. So perhaps it's an extra credit activity, or it's something that's used for a new hire working in aging and public health. It's used for coalition members. It's just designed to be a free, ready-to-use resource to support our current and future aging health professionals. And it's all on our website at alz.org/public health curriculum. So this Understanding the Public Health Impacts of Dementia module is just one of the many excellent products and opportunities from the Healthy Brain Initiative. If you haven't already, feel free to use the QR code here to sign up for our e-news. This is where we are announcing the release of our other work, as well as the new modules that will be coming out in the upcoming year. One of the upcoming events that I'll go ahead and plug is our Social Determinants of Health webinar series. It's put on by the Alzheimer's Association's Center of Excellence on Risk Reduction, and their final webinar in the series is at the end of the month on September 25th, and it's titled Creating Healthier Environments, Harnessing Social Determinants for Dementia Risk Reduction. So it's been an amazing series. I highly encourage you to sign up for it today and to be on that e-news to hear about other great opportunities. So thank you again for joining us today. And we do have time for some questions. So I am going to stop sharing my screen and see if we have any questions that we'd have time for today. There is a question about continuing education credits. So currently these modules do not have CEs attached. That is in the pipeline, in the works. We'd love to be able to add them, but there is not a current offering. We do have a certificate that you can print at the end of the module. There's a question about using the module in other languages. Unfortunately, it's only available in English right now. So that's something we may be able to explore in the future, but currently they are available in English. Let's see. Any other questions? I don't know. Yeah, Shelby?
Hey, Eva, there were a few questions that some of the panelists answered while you were talking, and I think, Alicia, there was one for you that you maybe wanted to answer live about the grants that you talked about and if there were opportunities for more, any future grant applications.
Or yeah, I think I pressed the wrong button, but for all of our bold public health programs, they are currently in year 1 of a 5-year cooperative agreement period. We do have our Centers of Excellence and our Healthy Brain Initiative grant recipients who are in year 4 of a 5-year cooperative agreement period. We currently have a forecast for a new notice of funding opportunity that's posted on grants.gov, but the actual opportunity will not be available until January of 2025. So we can post the link to the forecast in the chat.
Wonderful, thank you. And then the other question that I had was just, it's been fun to hear about the different work that folks are doing and just thinking about the future. What gets you excited about the future of public health and dementia?
Oh my gosh, that's a great question, Eva. So this is an exciting time because there's a big spotlight on this really, really important issue. So what gets me excited is just seeing all of the enthusiasm from others who aren't necessarily in the public health arena, because we know, this has been with the Healthy Brain Initiative 20 years in the making, trying to really get people to understand that Alzheimer's disease is a public health issue. So now seeing a lot of that force behind it has really been exciting, because we're able to see a lot of new research that's coming out, especially in terms of some of the things that we can do in midlife and younger to help reduce our risk for Alzheimer's disease and related dementias. So that's really exciting. And I think in the future, being able to incorporate more of those public health interventions into our jurisdictions is going to be really great.
Yeah, thank you. I think there's a question here for Lillian on how you assess your students' comprehension of some of the information they've learned.
Yeah, I think the instructor guide is a great place to start. There's all those sample test questions in there, as well as discussion questions. So I can think of a number of creative ways to ensure comprehension and that people did it. And then also, knowing that there is a certificate that people can print out. So if you really want proof that you finished this, you can always have your students send that to you or post it. So, but the instructor guide really has, I think, everything you'd probably need.
Yeah, thank you. And Brittany, do you want to talk a little bit about the evaluations that you do with your coalition members?
Yeah, so using the public health curriculum has been helpful to just see people doing a pre-test and a post-test after they are completing the curriculum. And also people love getting that certificate. I get so many emails from my coalition about, I need my certificate, I didn't get my certificate. So I'm like, okay, let me troubleshoot that for you. But being able to do a pre and post test and see, gauge folks' knowledge and see, what they've learned and fill in some of the gaps is helpful. for our coalition.
Yeah, thank you. Okay, well, I don't see any other questions. Let's see. There's a question if there's any curriculum about dementia for people younger than 65 years. And I will say we do mention that, and that some of the different types of dementia in this part 1, just understanding it's not always Alzheimer's and dementia can look different. So we do cover that, and try and differentiate between when we're talking about dementia broadly or if we're talking about Alzheimer's, which does have often more of the statistics. Oh.
Yeah, Eva, I just to add a little bit more to the how you assess if people learned something. The survey after the module does ask a few knowledge-based questions. And so looking back at the 2 that Eva mentioned that have been online for a few months now, we have over 90% of people reported a higher level of knowledge after taking the module. And then over 90% also said that they would be able to immediately use something that they learned in their school or work. So that was exciting for us to see those results come into.
Yeah, and then there's a question about CHES or CE credits. So this webinar does not have CE credits attached to it, and the modules do not either, although we are hoping that will be part of the future work. All right. Well, thank you all for being here today. We really appreciate it, and are excited to celebrate the launch of the new module with you. So thank you all for being here, and we are going to have a short evaluation survey, which we will drop in the chat. So please do take a few minutes to fill that out. It's very helpful for us, and look forward to seeing you on future webinars. Thank you again.